So really classic yoga position is called in Sanskrit Adho Mukha Svanasana, or the down-faced dog. It's an extremely useful one for working with breath work because of the way it works along the back line of the body to lengthen the back line, but also because it's an inversion. And what happens in this asana is that the lungs are brought below the intestines. And so the intestines press down the diaphragm. And the diaphragm, when you're breathing in, then has to work up against the weight of the intestines. So you're getting a really interesting effect in the body, with the blood flow coming back into the heart, increasing heart rate, and then on the out breath, that beautiful flow, reducing the heart rate, and that work on the diaphragm. So inversions are great, also bring the head below the heart. So you get a lot of good effects in terms of the balancing of blood pressure. So there's key things to pay attention to in the dog, in the down-faced dog. And how we're working the arms is one of those to get the effects accurate and effective in the system. So there are outward spirals in the shoulders and inward spirals in the shoulders and arms. These kind of movements in the arms and the same feelings in the legs that we're going to pay attention to, because they inform how the breath works in the body. Remember the breath function in the body? The diaphragm and the pelvic floor work in concert, whether they're working in harmony like this, or whether they're working with pressurizing the pelvic floor, which then affects the diaphragm, which then affects the deeper breath through the ribs. So breath and posture and how the body functions really matters. Now, one of the pieces that we're looking at as well is the relationship between the feet and the pelvic floor. And what I see a lot of in yoga classes is people being given instructions, things like take your heels to the floor. And what that encourages people to do is to pronate or collapse the insteps down. Now the instep is a powerful source of uplifting energy through the body. It's directly connected through the front line of the myofascia, and the spiral lines into the pelvic floor, into the breathing apparatus. Ida Rolf, from Rolfing, who's the creator of Rolfing, called the diaphragm the muscle of walking. And the diaphragm and the feet and the pelvic floor are an intimate relationship with each other through movement. So we're paying attention to these factors as we go into the dog. We're not going to just make a shape. We're going to find awareness and understanding and intelligence, both with the breath and with movement within that shape. Okay, so we'll start on the knees like we're doing. We're going to go to the hands and knees now. Hands and knees like this. So the hands are shoulder width apart, by which I mean this midpoint of the deltoid here, this point of the deltoid here, is going to come straight down through that middle finger. So these fingers are just outside of shoulder's width. This is shoulder width here. Hands wide. We're going to roll the shoulders outwards gently and make sure we can plant the big toe, the index finger, I was going to say big toe there, the index finger knuckle into the ground. If that's not possible, if when we turn the shoulder blades out, the hands pull off the floor, what we can do is simply turn the hands out a little bit. So instead of the middle finger pointing forward, the index finger points forward, and that will enable us to keep both that external rotation at the shoulders and the internal rotation at the forearms active. The feet are going to be parallel, the heels upright, and the toe space is open. This is really important in terms of how the foot functions in walking. So good foot function in walking is going to be a track from the middle of the heel pretty much through that second toe to the forward line there. Ideally we have space here. If you have complications in your toes where the toes have been pushed in through, I don't know, different kinds of shoes do that, from stilettos to climbing shoes, and sometimes it's just genetics. So if you can, keep the toe spaces open. And certainly one of the things I encourage people to do is to get barefoot more often. I wear barefoot technology shoes, so get the spaciousness in the toes. And this is the medial arch of the foot, which in the down-faced dog, we're aiming to keep that lifting as much as yours does. Some people have very low arches, some people have much higher arches. So we're trying to find that balance here of lift, the expanse between the toes, the spread across the toes here, and the balance between the inside and the outside of the heel. Right. So back into position on the hands and knees. Toes tucked forwards. Shake the head and jaw. Relax the neck. Come into the breath. 4 to 6 seconds inhale. 4 to 6 seconds exhale. And start this position simply by lifting the knees off the floor. Breathing out. Lift up here. And take some breaths. Breathing in. Knees bent to start with, even if you're familiar with this practice. So from here, we're going to engage the fingertips and the roots of the hands into the floor. Open the shoulders outwards, and you'll feel the muscles on the side of the body, latissimus, switch on. So to get those lats switched on here, press the first knuckle into the floor. So from the pressure of the inward spiral through that first knuckle and index finger, and the outward spiral through the shoulders, we generate lift up through the sit bones, lengthen the spine, and it pulls the shoulders into extension. Drop the head down slightly, look back between the toes. Check that the second toes are parallel to each other. Check the insteps are lifting. And from here, with the knees bent, we're going to just keep the feet completely steady on the floor and open the knees out very slightly and then rotate gently down, taking those heels in towards the floor. If your stance is very long, it's likely your insteps will collapse and the knees will turn inwards. If your stance is too short, it's likely your back will be popping forwards. If your back line is tight and you just push the legs straight, it's going to push your shoulders forwards or push into the back and hurt your back. So that's why we're starting with the knees bending here, checking the toe spaces. It's generating that upward energy from the outward spiral, the inward spiral in the arms, in balance, up through the sit bones. And then from there, working at lengthening those heels into the floor. You can walk the legs here if the back line is tight. So lift the toes, straighten one leg, bend that knee, walk the other leg into the floor, nice and gently, with the breath, full deep breathing. And when you've done that a number of times, find a position that you're most open in here, strong, steady, stable, and take 8 to 12 breaths here. It's absolutely fine to move in here. If you find a little bit of movement, a little bit of space, a little place where you can deepen into it. Maybe it's a spread of the hips. Maybe it's an opening of the shoulders. Maybe a bit more length through the sit bones. Then breathe into that. Really good breath. And to come out of it, simply bend the knees, come down, roll through your cat a couple of times either way. Great. And that is how we're going to do the dog at the moment. Of course, we can join all these asanas together into a flow, but getting the awareness and the integrity in the asana first is absolutely essential. If you think about our evolutionary history and go back to a time before we had chairs, when we lived on the earth, then there are 4 basic positions. Other than lying down on your belly or your back, there's 4 basic positions that human beings would have occupied. And all those are generally accessible to most people. One, of course, is cross-legged sitting. People would have sat on the earth like this. This is an evolutionary position that is very available to human beings. And the second position would have been kneeling. So if you just simply tuck your feet up, and you can roll between these positions. So for example, up into here, into kneeling. Yeah? Great. So this is the second of these positions, these earth-based positions. A third one would have been legs stretched out in front of you, like this. Yeah. So this base here, the long back line, for a lot of modern bodies is inaccessible. It's just too much because the body has become chair-shaped, and to straighten the legs out and sit upright is just not possible. So we can gradually rebuild that with intelligent breath-based movement. And the fourth of these positions is simply the squat. Here and here. And again, if you go to many places in the world, people still sit like this. So these 4 positions, the squat, cross-legged, legs stretched out, seated and kneeling, are the 4 base positions, the 4 earth-based positions, which is good to be able to occupy, as this is how your body has evolved and how it works well. Now, of course, if you look to a yoga class, what they do is they do variations of these. So most of the shapes in a yoga class are either some combination of that, yeah? If you think about the various different shapes you get in yoga, there's another one there, look, and there's another one there, yeah? They're all different variations of those different positions. Now, in a squat, when you come up to standing, and you can feel this if you come up into a squat like this, a simple squat. If you can't squat like this, if your heels are off the floor, put something underneath your heels and lift up in some way. If your knees are coming in like this, then again put something under the heels and lift up. So you want the arch lifting and the toe spaces open, and ideally, well, importantly, a track through the middle of the femur, through the middle of the patella, out through the second toe, and it looks after your knee joints in the squat. So if you can't squat, if it's not been something you've done a lot of, you can rebuild that over time, but we need to do it with functional integrity in the system. So we need that line through the femur, patella, shin bone, out through the second toe to look after your knee joints. So this position here, if you can come into squat, supported or not, and if you can't come all the way down, if your knee's a bit achy, then do it gently. Hold on to something, like a piece of furniture. Hold on to something and come down to where you can come down without strain, without pain, without hurting yourself. Yeah? All I want you to do is then come up slightly, and as you come up, you're going to breathe in and breathe out and lower down. And we're talking about a lift of maybe 2 inches, 3 inches. Then lift up here and pulse and come down. And when you do that, you're going to notice, if you pay attention, that the pelvic floor lifts at the front and middle. Now, you know full well in a relaxed inhale that when the diaphragm goes down, the pelvic floor goes down. But here we are. You're breathing in to lift up and your pelvic floor is lifting. What's happening to that? Isn't that interesting? So a good way to activate your pelvic floor and strengthen the pelvic floor is to come into the squat and practice this lift, this easy lift here, nice and steady, breathing well, relaxing the face and jaw. And release, come down. Now I'm sure we could sort out just about every kind of difficulty in the pelvic floor, from prolapses to erectile dysfunction, simply by breathing and squatting. And I can't guarantee that, of course, but in my vision, it's those kind of things make a huge difference to the human body. So we could do a lot of good work there. Isn't it interesting that when you come up in that evolutionary advantaged position of coming to squatting, your pelvic floor lifts, and of course what we know from that when you squeeze your pelvic floor up is it activates the transverse abdominals and lifts the front line. So we've got this evolutionary structure in the body which works from the insteps, from the feet, here, from the feet, up through the pelvic floor, up through the front line of the body to lift us up. Isn't that awesome? And that's what we're using within the breath work when we start activating the pelvic floor, and working through the front line of the body. We're using that evolutionary, kinetic, myofascial web